working. And then she said something again. She said, this drug where I take, where I carry belly. Funny, right?
Pull up on it, pull up to the bumper, sit down on it.
Hey besties, welcome back to my channel. It's your girl Zini. If this is your first time seeing this beautiful face, I am a community pharmacist based in Abuja, Nigeria. Thanks for stopping by. And if you're a returning subscriber, I love you so much. You all are the real MVPs. So guys, I'm back again with another interesting video, and there's a backstory. Two ladies walked into the pharmacy and I was attending to the lady who wanted to get medication, while the other one walked her way through the shelves. So she got to the part where we had our contraceptive, and then she picked this drug in particular, and then she said something. This drug, when did it work? So it caught my interest, and after I was done with the other lady, I had to approach her and I asked her why did she say the drug no they working. And then she said something again. She said, this drug where I take, where I carry belly. Funny, right? So I had to ask her because it might be that she took the drug wrongly. So after much investigation, I realized that she did not take the drug the right way, hence the pregnancy. So after more sensitization and obviously like enlighten her on how to take the medication, just in case of next time. When they left, I said to myself, there might be a lot of ladies out there who do not know how to take this medication the right way, leading to pregnancy. So guys, that is what I'm here to do, to tell you everything you need to know about this drug, when and when not to take it, and what to expect when you take it. So if this sounds interesting or something you want to know, then keep watching. This medication, whether you know it as post pill, Postinor2, emergency contraceptive, morning after pill, they are all the same thing. And the active ingredient here is levonorgestrel. This is a hormonal medication used in birth control. What it basically does is that it prevents you from getting pregnant after an unprotected sex. You're wondering how it works. How it works is by number one, preventing ovulation from taking place, which is the release of the egg or the ovum in the ovary. Now, if the eggs are not being released, they cannot be fertilized. So this drug prevents ovulation from taking place. And another thing it does is that it thickens the cervical mucus, making it difficult for sperm, the released sperm after having an unprotected sex, to swim to the eggs. So when the sperm cannot get across to the eggs, fertilization cannot take place, and obviously one cannot get pregnant. For someone who understands her menstrual cycle very well, can tell when she's ovulating. So if you feel like you're ovulating, or you know that you're actually ovulating and then you had an unprotected sex, please do not hesitate to take this drug. Like, take it almost immediately, because for someone who is already ovulating, the eggs has been released already, waiting for the sperm to get fertilized. Now if such a girl have a sexual intercourse without some form of protection, the fertilization is going to occur in almost immediately, because the eggs are ready to be fertilized. The earlier you take it, the better. It works within the space of 72 hours, that is 3 days. Anything outside that, or when you delay in taking this drug, it reduces the effectiveness and the chances of you getting pregnant is increased. So that's why you need to take this drug immediately. And the dose of this medication usually comes at 1.5 milligrams. So if you're getting a pack of Postinor2 that has 0.75 milligrams, that is, there are 2 tablets inside of it. You should take them 12 hours apart. So if you're taking one now, for example, the next one should be taken after 12 hours. But if you're getting post pill that has just 1 tablet inside of it, that is the 1.5 milligram, it's a start dose. So that's it. That is how to take this medication. So when you take this drug, there are some side effects you might likely see, such as headache, nausea, vomiting, breast tenderness, and irregular menstrual cycle. So your period can be earlier than normal or later than normal, and then the flow of blood can be very scanty. It just depends, because this is a hormonal medication. So that is why it's advisable for you to at least take this once a month. It's not something you should be on regular, because it's an hormonal pills and it can cause some sort of hormonal imbalance and every other thing that comes with it. So be careful. The things I feel like you should know about this medication. Number one is that it does not reduce the risk of you getting STI. So if your partner is sort of infected, you stand a high chance of getting that infection if you had an unprotected sex. So taking Postinor2 does not stop you from getting those STIs. Number two is if conception has already taken place before you take this medication, Postinor 2 is not an abortion pill, so you will still going to have that child. It has no effect on already fertilized eggs. So get ready to have your child, because Postinor 2 does not have any effect on already fertilized eggs. So that is all I feel like you should know about this medication. All right. So if you find this video very helpful and interesting, do not hesitate to share it to your friends, your family, your colleague, everybody actually, both male and female, because there is no limitation to those that can actually purchase this medication. You don't need a prescription to get it. You don't need some sort of license to get it. You don't have to be of a particular gender to get this drug. So the guys can actually get it for their girlfriends or for their wife or for anybody close to them, their sister. So please do not hesitate to share this video to everybody you know or your contact list, so they can watch it and get enlightened too. So guys, thank you so much for watching, and I'll see you all in my next video. Bye.
You feel like rain in the morning.